Hey, I'm Dr. Dino Pappas. Thanks for joining me. The content of this video are my views and my views alone. They do not represent the content of any entity or agency that I may be affiliated with. The clinical question of the day is, Doc, what do I do to shake this neck pain? And the answer to the question that I usually recommend to patients are three things. The first, posture correction. Let's face it, we've become more of a sedentary society. Let's face it, we're more on electronic devices, cell phones, tablets, computers. We find ourselves all day in this position where the head is protruded forward and we are looking down. So fixing your position and a posture at a desk, fixing your position and your posture when you're carrying your cell phone, so your head is up, you're looking at it like this instead of like this, or at a computer screen instead of sitting forward, bringing your computer screen and getting up does matter. I've created a video that I send to patients. I'll put the link here in this position during the presentation. Sleep position. Well, a lot of times patients with neck pain do not get good sleep. They don't get good sleep. It's more painful during the day. They're more irritable. Their spouse says something. They're already irritated because they're in pain. Next thing you know, it snowballs and on and on and on. So sleeping in a correct position is good. I've also created a video about that. I'll put the link right about here in the video. But the important part with sleep position is that the head is not too elevated. You don't have too many pillows. You don't have too little pillows where you're looking up towards the ceiling. So the head maintains a neutral position here. If you're on your side, your head is not cocked up with too many pillows and it's not slumped down with too many pillows. Keeping the head level with the torso is the central theme of sleeping position. You get good sleep, it hurts less the next day, your spouse will thank you. And then directional preference. Well, what is directional preference and what is directional preference exercise? Oftentimes we find positions of the neck, doctors like myself, chiropractors, physical therapists, where we position the neck in certain spots and we can reduce pain or make pain leave an area of the body, like if neck pain is referred to the shoulder, leave the shoulder, move back to the neck. Or if neck pain is referred down the arm, it leaves the arm and moves back towards the source. So it reduces pain, makes pain move back to a central location, and improves the quality of your life. Sleeping, sitting, working at a desk, holding on to things with your arm. That's a directional preference exercise. A position of the neck that reduces pain, increases pain-free range of motion, increases the quality of your life, and makes pain move back to a central source. The two most common positions, the two most common exercises is something called cervical retraction. This is simply giving yourself a double chin. So pretend like a person is trying to kiss you and you don't want them to kiss you. They're going to pull back. From a side view, I usually have the hands in the upper portion of the back. I usually will say tuck your chin back, give yourself a double chin, or pretend like there's somebody trying to kiss you that you don't want. From the front view, it looks like this, chin's coming back. I'm pulling forward on my upper portion of my back to get myself a little bit mobility. The progression from that exercise looks like this. Again, pretend somebody's trying to kiss you and you're trying to pull back. I'm going to put my hands on my upper back, my chin's coming back. I'm going to raise up towards the ceiling like this and even add a little bit of a wiggle to the side. Side view, hands on the upper back for pressure, chin's coming back. I'm going to look all the way up, add a little bit of a wiggle on the top. I usually recommend those exercises, one set 10 to 15 reps, about 6 to 8 times during the course of the day. Please check with your prescribing provider or your healthcare professional for more specific information to you if those exercises are correct or if they need modification. I'm Dr. Dino Pappas. Thanks for joining me. If you like the content, please turn on those notifications and make sure to hit subscribe. Thanks for watching.